And just to give a little bit of background, so I joined Blue Cross in 2021, and one of the first things when I looked at the program was lack of data sharing between providers and payers. And we started to have that discussion with the provider groups to say, like, what are we missing? How can we better the performance? Let's look at the VBC contracting. What is the key element that is missing? Was data sharing. So immediately we were tasked, or I took over the responsibility of building an analytics function within the organization. And the more we started looking at the data and looking at, we were able to unearth some of these gaps that were missing, or that the gaps that were evident, and the data sharing that and data transparency that was missing. And when we reached out to the providers, the first thing they said is, we don't trust payer data. We don't trust anything that comes from you because we've often seen it's wrong. And the more we started dialoguing with the providers, we understood that many of our providers within our network heavily relied on EMR and just data within the EMR. And so there was some education from our standpoint to say, look, EMR is great. You're getting all the data. You're closing these gaps on a clinical front. But as a payer, we do a lot more function than just clinical data coming from an EMR. Yes, we have that information coming through claims, but we do retrospective medical record reviews. We get supplemental data from hospitals and other inpatient facilities. We also do suspecting using clinical data, pharmacy data, and other claims that are coming in. So there's a plethora of information that a payer has that we would love to surface and share with you, so you are able to, when you see a patient, provide a better care, build a better care transformation plan, and start trusting that data that we give you. So it was a constant dialogue for a good 6 months to a year, and we showed the value by getting the retrospective review data out to them, saying, okay, this data is coming from a specialist that is not within your EMR. You don't have that information. And we showed them the evidence. And the moment we started doing that, we started building trust with the provider groups.